Hello my friends, welcome to my very amusing dog Mobey. She is going to be with us on this video today because that's where she wants to be. In this video we're going to talk about lupus. What the hell is it? How does it show up? And how does someone get diagnosed? Okay, first thing first, what the hell is it? So lupus is considered an autoimmune disease. So in a healthy individual, the immune system, it's there to be a warrior, right? When these cells and these viruses come into the body, the immune system goes, attacks them, kills them, eradicates them, and off they go. That's how it's supposed to work. But when you have lupus, your immune system, is out of whack. And so it has trouble determining what is good and what is bad. So of course it goes after the bad things, but it doesn't stop. It also attacks your own cells in your body. It attacks the organs, it attacks the tissues, and so you get this constant damage. And it's one of the reasons why you'll see lupus is a full body symptoms, that everything from the little hair on top of your head to the little baby toe can be affected by lupus. Now, lupus is also a chronic disease. The word chronic typically applies something that is long-term, lasting into months, but with lupus, it lasts from years into decades across a lifetime, because at the moment, lupus is not curable. Now, there are going to be times when the disease activity is high, and that's called a flare or a flare-up, and other times, which is the holy grail, which we all pray for, we want in life, is when you're in remission. I don't think I know anyone in remission yet, but that's when the disease activity is very low for a specific time. So it's chronic, it's a broken immune system, and you're going to find that there are 4 different types of lupus. SLE, which is systemic lupus erythematosus, which is a lupus I have. It's the most common, as it accounts for 70% of all cases. It's also the most damaging and most severe. The second type of lupus is called cutaneous lupus. This is when lupus is contained to the skin, often being as a thick, scaly rash, and that accounts for roughly 10% of the remaining cases. And then we have the third is drug-induced lupus. So when you take drugs at a very high rate, it can bring on this certain type of lupus. But the good news is when you stop those drugs and the drugs get out of your system, you no longer have that lupus. And then the fourth and the final one is neonatal lupus. As you know from that word, it implies that when a baby is born, it receives those antibodies coming from the mother, and so for a temporary time the baby does have lupus, but from everything I've read, that the babies go on to live a very healthy life as this is moved out of their system. All right, let's talk about the symptoms of lupus. This is where it gets really challenging because I feel that the definition or the wide range of symptoms is so broad. It accounts for like everything that happens to me. I'm like, that's lupus, and that's lupus, and that's lupus. So overall, what you want to know is that it can affect basically every single area of the body in different ways. From the top of the head being your hair, that you lose your hair or a thinning of the hair, sometimes related to flare activity, sometimes not. In the mind, it can bring on neurological issues like a seizure disorder. It can have a lot of brain fog or NPSLE, which is neuropsychiatric lupus. In the mouth and the nose, there can be mouth and nose ulcers, which are painful areas that exist. Going down the body, of course, the joint pain that is often there, the pain in the body. You might have some swelling in the legs. You might have pain in the feet. You can have kidney issues. Kidney nephritis, or lupus nephritis, I should say, is common, unfortunately, in roughly half of the lupus cases. You can even get into issues with lung infections, lung issue, pleurisy, like the pain that you feel in the heart. I have a weird thing that has all of these ridges all over my fingernails. If you felt them, they were all bumpy. I've learned that has to come with lupus. You know, I could go on and on about the symptoms of lupus because lupus does show up like a snowflake. Like everyone has their own design of a snowflake. And that means that it manifests or represents in a unique way for me, as it does for you. And it doesn't make it as simple then to understand or how to see exactly how lupus is there. the most common things that you can think of when it comes to lupus is fatigue, like I slept all night 8 hours and I'm getting out of bed and I'm having a really hard time simply getting dressed, or making breakfast is exhausting. Don't even think about doing work or trying to figure out what's going on with that. Now, the one I mentioned before are ulcers. These are the mouth or the nose sores, almost like you bit your cheek and it's the sore left behind, like that white, really sensitive sore, but it's not. It's just a sign of lupus. Swelling, usually around the eyelids, the legs, the feet is common. Anemia in 50%. The buses just love to come by today. Anemia, 50% of people experience anemia, and that's the body's having a challenging time dealing with that stored iron. Hair loss is another one that is too common, and that's actually one that gave me some fire up under my ass to go figure out for sure. I'm like, this is lupus now. My hair is being lost. This is very serious. So when it comes to your diagnosis, the American College of Rheumatology says that you need to have 4 of the 11 criteria in order to get a formal diagnosis, because there isn't one blood test, we wish there was, that simply said, yes, she has lupus, or no, she does not. Your doctor, your rheumatologist, that specialist, has to know what's going on with your body and run these blood tests. And that's why they have to be not only a physician, they have to be a detective as well. So let me read to you the 11 conditions from this book. All right. Out of the 11, let's read. A butterfly rash on the cheeks. A rash on the face, arms, neck, or torso. Sun sensitivity. Reoccurring mouth and nose ulcers. Stiffness, swelling, and or pain in the joints. Inflammation of the lungs or around the heart. Abnormalities in the urine, like protein in your urine or blood in your urine. Nervous system problems like seizures. Problems with the blood. This one I've had for a long time, which I showed up as vitamin D was low, calcium was low, maybe the white blood cells are low or the platelets are low. Lab tests show an increase in autoimmune activity. And then finally, the 11th is a positive test from an anti-nuclear antibody blood test, and that is called an ANA. So lupus is quite difficult to diagnose. It takes between 5 to 7 years to get that formal diagnosis. And during that time, you may be wondering, like, what the hell is going on? Why can't my physician just give me a, yeah, you have lupus, or thankfully you don't have lupus? The reason is many reasons, many excuses. One being that lupus progresses in stages. How I am today will most likely not be as I go on in that diagnosis. Also, some symptoms show up today and they may go away at another time, making it challenging. It mimics other diseases like fibromyalgia, like rheumatoid arthritis. They thought I had that once, like a bacteria infection, right? Fevers being one of the common side effects. Yes, your car is loud. Thank you. Fevers being a common side effect. Usually some women may have them around 100 degrees or below, and you might think there's something going on, have an infection, your doctor's going to treat you for it, when in fact it's something that is going on with lupus as well. And then finally, the last thing we want to talk about is that you can have lupus and you can also have other conditions, because we know it's 25 to 30% of people who have one thing may have something else, like how I have lupus and I have Sjogren's, and so where one starts, the other begins, and it gets really washy out there. Hence why that detective work is so needed by your rheumatologist. So in the end, I don't want you to give up that fight if you have a doctor who doesn't say what you want to hear, that you know it's lupus, but they just won't tell you that. I don't want you to give up hope. What I want you to do is keep on fighting. Keep on finding a new rheumatologist. Maybe stay with the one you have, as you know it's several months to get into a new rheumatologist, but continue fighting, arming yourself with education, arming yourself with self-awareness of what's going on with your body, so that when you get into that doctor, you can give those resources that help with your diagnosis. But in the end, no, my friends, you are not your lupus because you are far more. And until we meet again, take care.